Hello, my name is Mike. Today I'm going to be showing how to perform venipuncture on a patient. Prior to this skill, what I would do is check the orders per the healthcare provider. And while I'm sitting there looking over the orders, there's some things I want to think in my mind, the purpose of each lab and why I'm drawing them. So, for example, based on the patient's condition, there might be some reasons why we're drawing these labs. For example, we have all these different types of tubes here. As you can see, they're all in different colors, and each one is for a different purpose. So, for example, this is again per hospital policy. There might be different tubes for different labs, but generally the purple top would be a CBC. This is a complete blood count. This is what we would look at to see for hemoglobin, hematocrit, white blood cell count. We have the yellow top, which is usually your chemistry or your CMP, BMP. This is looking at the electrolytes of the patient. We have a blue top, which is the coagulation lab, PT, PTT-INR, all different reasons for maybe possible bleeding or clotting. We have the pink top, which is usually a reason for a type-in screen or a type-in cross-match for possibility of giving blood. And green could be, venous blood gas or arterial blood gas. It could be for any reason. They have different hospitals have different reasons for each one. The other things I want to do is assess the risk for the patient. Patient could be presenting with anemia, could be a trauma patient, might be losing a lot of blood. So there might be reasons why I may or may not want to draw blood on this person or on this patient, and why I might want to check back with the provider to see if they really want certain blood work drawn. The other thing I also want to assess prior to drawing blood is if the patient has a limb alert, reasons why we would not want to perform venipuncture on a certain limb. For example, the patient could be a prior mastectomy. They may also have an arterial venous fistula. These are also some contraindications why you would not want to perform venipuncture on a given limb. Now that I've assessed that I'm going to perform venipuncture on my patient, I'm going to gather my supplies. So some supplies I'm going to need for is some gloves, some hand sanitizer, or anything for hand hygiene. We have a 2x2 gauze, tourniquet, alcohol pad, the venipuncture set, the butterfly needle with the vacutainer holder, the appropriate blood tubes that are per the hospital policy, and reinforcement tape. And also prior to, I might also want to get some labels for the tests that we're going to be performing and drawing on. The other thing I'm also going to be I want to also be conscious of is the exposure to blood and blood products. So I would also might want to bring a biohazard bag for any type of excessive bleeding that might occur, because any type of blood exposure needs to go into a biohazard bag. So now that I've gotten all my supplies, I'm knowing what I'm doing, I'm going to introduce myself to the patient and identify the patient utilizing two patient identifiers. So first name, last name, and their date of birth is usually acceptable per hospital policy. I'm going to explain the procedure to my patient, get consent, they're okay to perform venipuncture, and why we're performing it. And since I've not gotten the patient's consent, I'm now going to perform the skill. So I'm going to perform hand hygiene and don my gloves. Once I've explained the procedure to the patient and have gotten their consent, I'm going to apply the tourniquet. I'm going to apply it using a quick release tie. And I'm going to take this time to find a good vein to draw blood from. I'm going to palpate for the vein and palpate for venous return. Usually the preferred methods or preferred sites for venipuncture are usually the median cubital or the cephalic vein, but if they're not the best sites, I would prefer looking for one that's easily palpable for the vein. Once I found a site I'm happy with, I'm going to release the quick tie tourniquet. And if you notice, it's a quick tie because I'm able to release it with one hand. Once I've released the tourniquet, I'm going to take off my gloves, perform hand hygiene again, give the patient a minute to rest with the tourniquet off, and set up my supplies. I'm going to open my butterfly set. Being mindful to the rubber stopper in here, there is a needle on there, so just be mindful to that you don't stick yourself. And I'm going to apply the vacutainer. Screw it on, and now it's ready. Open my alcohol. Open my gauze. I'm making it easy for myself because as I perform the skill, I'm going to have limited access to supplies. I have all my vials in a row. Also, per hospital policy, they can, it's important to know the order in which you will draw the blood tubes just so that you don't produce an erroneous test result. So be mindful to the hospital policy and how you draw these bloods. All right, and once I'm all set and ready to go, I'll tell the patient I am going to perform the venipuncture. Wash my hands again, and apply gloves. I'm going to reapply the tourniquet using the quick release tie. I'm going to clean the site that I'm happy with for at least 15 seconds. It's important to apply good friction to clean the site. Once it's clean, I'll toss it. And now that that site has been cleaned with alcohol, it's an aseptic site, so you don't want to touch it again after it's been cleaned. I'm going to give it a minute to dry. Get my tubes in order. And once the site is dry, I'm going to uncap my needle. Being mindful to where the needle is. I'll pull below the site I've cleaned to stabilize the vein, going in at about a 15 to 30 degree angle. And I'm observing for blood return in the chamber to make sure that I'm in the correct spot. I'll stabilize it with my hand and get the blood tubes in place for the vacutainer. Again, each tube can be different. You want to look at the site that on the blood tube where I'll tell you to draw the blood to. Usually, most of the time, the blue tube, the coagulation tube, usually you want to fill that up to the top. But say the CBC, usually just a couple drops of blood is all you need. So it's all dependent on the blood tube. And if you see, I'm not moving my right hand, I'm making sure I'm stabilizing the needle and utilizing my left hand to change each tube. It will take some practice to get the dexterity, but it's very important that you have one hand to stabilize the needle and one hand doing all of the movement. As I'm drawing the blood, I'm reassuring the patient, making sure that they're doing okay. Once I've collected all the samples I need, I'll release the tourniquet, get my gauze ready, and I'm being mindful to where the needle is so that I don't stick myself when I'm withdrawing. So I'm going to pull back, and once the needle's out, then I'll apply pressure. And be also mindful to the supplies that you're at which facility. For this one, the safety mechanism, you push the button to withdraw the needle. That's the safety mechanism. Each place might be different depending on each supply. Just mentioned about this vacutainer. You don't want to retract the needle when it's inside the patient. You want to withdraw the needle first, out of the patient, and then push the button to activate the safety mechanism. Now that I know that the needle's retracted, I can put this down for just a second, being mindful to where it's at. And I'm observing for any excessive bleeding, any hematoma development, applying pressure and ensuring that the bleeding has stopped. Once the bleeding has stopped, I will dress it with some tape. Clean up my supplies. I'm going to take this straight into the sharps container. Toss the rest in the garbage. So, as I mentioned before, there are some labels per the facility that you're at. Generally, what you're going to make sure is you're going to make sure it's got the patient's name, their date of birth, their medical record number. You might have to date, time, and initial the time the sample was collected. And once these are labeled, I'll place this in the biohazard bag. Take off my gloves. Perform hand hygiene. And then prior to leaving with the samples, I'll make sure the patient's okay, make sure the room is safe, check on the patient, make sure they're doing okay, if they need anything. And once I'm satisfied, I will take this, send this off to lab, and that is it. And then you're also going to document too how the patient tolerated the procedure, any complications that may have arose from it. And that is it. Thank you.